Hello everyone, myself Dr. Karthik Digutla. I'm an anesthesiologist and a part-time YouTuber. So in this video we will discuss what are the pros and cons of choosing anesthesiology as your career. Alright, so what are the cons in becoming an anesthesiologist? Let us know what are the cons first, then we'll go to pros. So the first con is high stress. Anesthesiologists work under immense pressure and their job requires them to make quick decisions even in critical situations. They need to monitor the patient's vital signs constantly, and any slight change can also have severe consequences. The second con is the long working hours. Anesthesiologists work long hours, including the weekends and holidays, which is like any other branch, and they may also be on call for emergencies, which can disrupt their personal life. This is possible with any other branch, and it is also possible with anesthesiology. Alright. Then there is high responsibility. Anesthesiologists are responsible for administering anesthesia and ensuring that the patient is comfortable and safe during the surgical procedures. They need to be well versed in the latest advancements and technologies and the new medications, which can be prepared to deal with any adverse effects. The fourth one is the lengthy training. Becoming an anesthesiologist in India is like preparing for NEET PG, getting an MD in anesthesia and joining. But when it comes to medical schools in US, if you are writing USMLA and all, then it is definitely a long and lengthy procedure for becoming an anesthesiologist. It includes 4 years of med school, then 4 years of anesthesiology residency, and again additionally they require fellowships also. So it might take around 9 to 10 years for you to become an anesthesiologist, which will again require long and so rigorous training also. The fifth con of choosing anesthesiology as a career is the risk of burnout. Anesthesiology, though it is a demanding job, it can lead to burnout, especially if the practitioner is working for long hours. For example, for those people who are doing freelancing and all, they work at an institute, then go out for freelancing. Like their sleep schedule will be very less, like 3 to 4 hours. Also, I have seen few anesthesiologists working for very long hours and like maintaining very low work and a personal life balance. So in that case there is high risk of burnout, and also during the first year of your post graduation there is a high degree of risk of burnout also. So dealing with high levels of stress and facing challenging cases is a first or primitive thing that you have to adapt yourself to avoid the risk of burnouts if you are choosing anesthesiology. And the next thing is high liability. Anesthesiologists are responsible for administering anesthesia, which can be very risky. Sometimes the anesthesia has more risk than the surgery itself, and it can be potentially life-threatening. As a result, they may face a high risk of malpractice suits and also legal issues, the legal liability. Alright. Then there is something called as the emotional toll. Anesthesiologists may be exposed to emotionally challenging situations such as dealing with critically ill patients or dying patients, and this exposure can take a toll on their mental and also emotional well-being over time. And the next thing is anesthesiology is not an OP branch like all other branches like general medicine, general surgery, dermatology, or even when it comes to pediatrics. You have to write prescriptions to the patient, you'll see OP and all. But in anesthesiology there are no such things. There is a pre-anesthetic checkup or pre-anesthetic clinic, which is the evaluation of the patient pre-operatively, which is done by an anesthesiologist, but definitely which is not equivalent to what you see in the OPD. So if you are that kind of a person who wants to write the medications, write the laboratory tests and all to the patients and evaluate the patient, you are interested in knowing the differential diagnosis and all, then this is not a branch for you, anesthesiology. Alright. Now let us discuss the pros of choosing anesthesiology as a career. The first important thing is high demand. Anesthesiologists are always on high demand, at least for now, without even doing a fellowship or a DM, unlike general medicine and general surgery where you have to go through a DM degree also after finishing your MD. But anesthesiologists are still even today's date, they are on high demand even in cities, even in urban and rural areas. They play a crucial role in the surgical procedures, and also anesthesiologists work round the clock for the critical care units also. So All right, so there is a very high demand in every hospital 24/7. Okay, then good income. Yes, anesthesiologists, likewise other branches also, the salary of any specialty for that sake depends upon where you are working and the level of experience. Where you are working, the level of experience, and the third thing is how many hours you are working. There are multiple factors which are going to decide your income. So in general, if you point out, every branch is earning the same, not that anesthesiologists earn less or more or other branches earn more. It depends upon your location and level of expertise, and also the hours of work which you are doing in that particular profession. And of course, the salary might plateau at a particular point, unlike surgeons where the salary increases as the number of years of experience increases. The salary might increase, but when it comes to anesthesia, you might achieve a plateau when it comes to income. All right, then there is a diverse work environment. Anesthesiologists work in various healthcare settings, including hospitals. They work in pain management clinics. Then they work in ambulatory surgery centers. Okay, they work in the critical care units. They work in emergency departments. There is a wide range of places where you can work if you do MD anesthesiology or DNB anesthesiology. All right. Then there is a professional satisfaction. Anesthesiologists play a crucial role in ensuring patients are comfortable, patients are pain-free during the surgical procedures, which is the most important and the whole purpose of giving anesthesia. They are involved in various stages of patient's care, from the pre-operative evaluation to the post-operative care, making their job incredibly satisfying and fulfilling. You'll get instant reward when you do anesthesiology. Moving on to some more pros of choosing anesthesiology. There is usage of advanced technology when it comes to anesthesia. If you are a gadget lover, then yes, this is the branch for you. Anesthesiologists have access to cutting edge technology and equipment such as ultrasound machines, monitoring devices, and advanced anesthesia techniques also. And also, when it comes to anesthesia, you learn what is known as leadership and teamwork. Anesthesiologists work closely with all other healthcare professionals like surgery, orthopedics, ophthalmology, otorhinolaryngology, ENT and all. Okay, so anesthesiologists work very closely with these branches also, and also they work with other cadres like surgeons, nurses, anesthesiologist assistants, making it a highly collaborative and oriented field. That is why if you see, anesthesiologists are usually the superintendents of the hospital or the management of the hospitals. Usually they keep anesthesiologists in the forefront. All right. Then if you go on for more pros, there is something called continual learning. Anesthesiology is a constantly evolving field. It is a new field, and practitioners must stay up to date regarding the latest advancements in terms of technology, in terms of medication, in terms of techniques. This ongoing learning can make the job intellectually stimulating and also challenging for every anesthesiologist. So you have a lot of scope of learning because it is still an evolving branch. Then moving on to the last pro, flexibility. Anesthesiologists have the option to work part-time, full-time, or as an independent contractor also. This flexibility can provide a better work-life balance and allow for more control over their schedule, and you can take control of your time. I hope this was helpful. So overall, as a gist, choosing anesthesiology as a career requires a significant investment in education and also in training. And take anesthesiology only if you are interested. Don't take it like it is the only branch left for you or you don't have other options. Don't take it like that. So significant investment of education training is there, and job can be demanding and stressful at times. So if you're not interested, you will feel burnout in that case. However, the rewards including good salary, good job satisfaction, and access to advanced technology may make it a worthwhile option for you if you are interested in this field. Alright, so if you like the video, do drop a like over there. If you haven't subscribed yet, please subscribe to my YouTube channel. See you in the next video. All the best.